HPV vaccination rates are the lowest among Hispanics, males and Americans with low education levels, according to a new study, and the reasons may include lack of knowledge surrounding HPV, including a misconception that a women's vaccine. 0.42 million. That's how many Americans are infected with the types of HPV known to cause disease, according to the Centers for Disease Control and Prevention. Around 13 million American adults and children are infected each year. The HPV vaccine is a series of 2 or 3 shots, and was first approved in 2006 for only women, 5 years before it was approved for use in men. Because of this, the vaccine has historically been known as a women's-only vaccine, though men also benefit from it, according to a study published in Preventive Medicine. HPV can cause several types of cancers like cervical and vaginal, but the most common type of cancer it leads to is oropharyngeal, according to the study, and 75% of patients diagnosed with this type of cancer are men. Although vaccination rates among Hispanic teens is high, coverage among Hispanic adults is low, a 2023 study found. The study chalks this up to potential misconceptions among the community, as Hispanic participants were 8% more likely to believe HPV-related misconceptions than non-Hispanic participants. A separate study found Hispanic men and women had the lowest knowledge of HPV, while non-Hispanic white women and men had the highest. The lack of awareness among those with lower education statuses may be the reason for lower vaccination rates. Only 40% of adults with less than a high school education are aware of HPV, compared to 78% of adults with a college degree or higher, a JAMA Network Open study found. Religious reason may also be the cause of low HPV vaccination rates, as some religious leaders advise against getting vaccinated since they believe it promotes premarital sex, according to a Current Oncology study. Research also shows the COVID pandemic may have affected HPV vaccination rates. Researchers examined HPV vaccination rates in young adults in 2018, 2019 and 2022, and found that although rates increased between 2018 and 2019, there was no significant change between 2019 and 2022. They concluded the pandemic disrupted young adults from starting the shot series. Overall negative sentiments toward vaccines following the COVID pandemic may also play a role. Some 3% of kids entering kindergarten for the 2022-2023 school year had exemptions for vaccination, which is the highest rate ever reported in U.S. history. Although health agencies have found the coronavirus vaccines to be safe and effective, experts believe the uptick of vaccine exemptions among children is related to skepticism of the updated COVID vaccines approved for use in 2023. Public perception of the importance of childhood vaccines declined in 52 out of 55 countries studied during the COVID pandemic, according to UNICEF.